Progyny manages your infertility benefit, and they have a structure of a smart cycle benefit. So that's your lifetime maximum. You get a certain amount of smart cycles, and then each type of fertility treatment takes up a different portion of that smart cycle. So kind of like pieces of a pie. Progyny can be contacted through your HR department. They should be able to give you the contact information for Progyny. And with Progyny plans, each patient has an assigned patient care advocate that works with them from Progyny. So that patient care advocate is going to be able to keep track of how many smart cycles you have remaining in your benefit. And they can also educate patients on their estimated out-of-pocket cost for treatment. So whatever is going to apply to that deductible or co-insurance or anything like that. Progyny does require authorization for all diagnostic services and office visits as well as treatment. So we do recommend contacting Progyny to get registered before your new patient visit so that you have your Progyny ID ready when you come in for that appointment. That first appointment, we recommend that patients block out about 2 to 3 hours of their schedule because they're going to meet with the doctor, they might do some testing, and then they'll meet with their assigned nurse and their financial counselor. So that first appointment takes a long time, but most of their repeat appointments that they come in for might just be a quick ultrasound or a quick blood draw, or maybe a uterine evaluation that shouldn't take longer than about 30 minutes. So most of those repeat appointments are a lot shorter than that initial consult. The way that Progyny structures their fertility benefit is with smart cycles instead of like a dollar amount lifetime maximum, which is how a lot of insurance companies are structured. So Progyny breaks out a certain amount of smart cycles for their plan, and then you have a patient care advocate with Progyny that you would work with to determine how many smart cycles are left and how those smart cycles can be used for different types of treatment. So with Progyny, they have that smart cycle structure. So an IUI might be worth a certain portion of a smart cycle, where an IVF cycle is worth a separate portion of the smart cycle. So it's kind of good to strategize with your patient care advocate and find out how much value is assigned to each type of treatment so that you know how you want to use your benefit in the smartest way. Fertility benefits that might be offered through your Smart Cycle benefit with Progyny would be IVF treatment, IUI treatment, egg freezing, sperm freezing. Medications may or may not be included as part of your Progyny benefit. Egg donation and sperm using donor sperm or donor egg may be included in that benefit as well. Or if they're not included in the benefit, you may be able to get reimbursed for those charges if they won't pay for those up front. If you have a benefit through Progyny, you have your set number of smart cycles that you can use for treatment cycles. However, we are also able to bill Progyny for diagnostic services, and that doesn't come out of your Smart Cycle benefit. So we get a separate authorization from Progyny for your new patient appointment and any diagnostic testing that may go along with that. That initial authorization is typically good for 90 days, and then after that, the assumption is you would start treatment and then you would start using your Smart Cycle benefit. Genetic testing of the embryos does have 2 separate fees associated with it. The first fee is for the embryo biopsy, which SRM performs, and so we bill for that portion. That would be included with the cycle authorization through Progyny, so that would just be billed with the rest of the cycle charges. The other fee associated with genetic testing of the embryos is the charge from the lab doing the testing. So they do bill separately, but they're contracted with Progyny. So they would bill Progyny directly for that portion. Progyny functions very differently from any other insurance company in that we as SRM, we bill Progyny for any services that are done, And then Progyny bills the patient directly for their out-of-pocket costs. So any deductible or coinsurance is going to be collected directly by Progyny. So that's part of the reason why we always recommend that patients contact Progyny directly if they're wanting to know any out-of-pocket costs, because at the end that bill is going to come from Progyny instead of from us. Coverage for treatment is only going to apply if you're enrolled on that insurance plan at the date of service. Unfortunately, you can't backdate the billing. So moving forward, if you do any future treatment cycles, then those can be billed to Progyny, but past treatment can't be retroactively billed.